What exactly is HIV? And what is AIDS? Hi, everyone. Today we're talking about HIV, a virus that affects your immune system, and AIDS, the condition it can cause if left untreated. In South Africa, over 7.8 million people are living with HIV, the highest number in the world. But the good news? With the right treatment, people with HIV are living long and healthy lives. Let's now talk about HIV itself. HIV stands for Human Immunodeficiency Virus. It attacks your body's CD4 T cells, which are important white blood cells that help protect you from infections. When these cells are destroyed, your immune system gets weaker, and you're more likely to get infections like TB, pneumonia, or even certain cancers. Let's now move on to how HIV spreads. It spreads through unprotected sex. Sharing needles, from mother to child during childbirth or breastfeeding, and rarely, through infected blood transfusions. So, where did HIV come from? Scientists believe it originated from chimpanzees in Central Africa, where it crossed into humans through hunting and contact with blood. Let's now talk about AIDS. AIDS stands for Acquired Immunodeficiency Syndrome. It happens when HIV isn't treated and your immune system is very weak. But with treatment, AIDS can be prevented. Let's now move on to testing. Most people get tested using a rapid finger prick test, which gives results in minutes. We also use the CD4 count to measure how strong or weak your immune system is. Let's now talk about treatment. There's no cure for HIV yet, but the treatment is very effective. It's called antiretroviral therapy, ART, and it helps stop the virus from multiplying, which protects your immune system. In South Africa, we use a combination called TLD, tenofovir, lamivudine, and dolutegravir, as the first-line treatment, usually for people aged 10 years and older. Treatment depends on things like your age, whether you're pregnant, and what medication is available, etc. Let's now talk about HIV in pregnancy. An HIV-positive mother can breastfeed, but only if she is taking treatment properly and the virus is undetectable. This way, the risk of passing HIV to the baby is extremely low. Exclusive breastfeeding is recommended. That means breast milk only, no formula or other liquids for the first 6 months. Let's now move on to an important point. Even though there's still a lot of stigma around HIV, it's actually one of the most manageable medical conditions. With proper treatment, the virus can become undetectable, and when it is, you can't pass it to others. This is called U equals U. Undetectable equals untransmittable. Still, always remember to practice safe sex. That's a quick breakdown of HIV and AIDS. I hope you learned something new today. If you found this helpful, like this video, and subscribe for more short and powerful health tips. Stay safe, stay informed, and see you next time.